Hi, my name is Kristen. I'm one of the nurse practitioners that works at the Vein and Cosmetic Center, Tampa Bay. I've been working with Dr. Hunt for the last 9 years, and today we're going to discuss Botox. At the Vein and Cosmetic Center, Tampa Bay, we do full face and neck Botox. We do a lot of specialized techniques. For you patients that are not familiar with Botox, it's very safe. It is botulinum toxin type A. It's a purified protein. It's a denatured toxin. Just like the making of penicillin, because we're a bacterial derivative, so does the making of Botox. It's been FDA approved for 14 years. It's from the makers of Allergan. And keep in mind, you cannot be allergic to Botox. There's no drug interactions with Botox. You can theoretically hit a blood vessel or nerve with Botox, not cause any harm. And today we're going to show doing Botox in multiple areas of the face. We're going to show the number one area for Botox is the glabellar. Keep in mind, Botox is great for all that dynamic movement, all that movement of expression. We know decades of frowning and furrowing and raising our eyebrows and squinting and smiling. We get all these static lines of expression. So the theory behind Botox is Botox will smooth out fine lines and wrinkles we start in our 20s in order to prevent new lines from forming. And most people don't realize, as much as we use Botox cosmetically, there's now over 100 indications medically, therapeutically for Botox. So today we're going to utilize Botox in the glabellar. This is the frown. Anatomically, this is your procerus muscle, and these are your corrugator muscles. These are antagonistic. These are depressor muscles. So when you do Botox here, you're going to get a nice medial lift. We're also going to do around the orbicularis oculi muscle. This is where we get the crow's feet. We always inject that tail into the oculi muscle because a lot of us, as we age, get that little bit of hooding, that little bit of tissue ptosis on the upper eyelid. So we're going to do everything we can to get a nice lift. So we're going to inject around that orbital rim. We're also going to do the frontalis muscles. Again, the glabellar is the depressor muscle, the oculi is the depressor, but your only elevator muscle is the frontalis. Where people make mistakes and cause a heavy brow is always going to be on the frontalis muscle. The key with the frontalis muscle is there's always an imaginary mid-forehead line here. Stay along that line or stay high on the frontalis because we want a nice lift. Men are the exception. We want to keep a male's tonic brow. That would be more normal for them, but women will want a nice arch brow. Remember, there's no antidote for Botox. So once Botox kicks in, if you ever were to cause brow ptosis, it's going to take a while for that to actually correct itself. So you're always better off bringing a patient back. If you ever have like a witchy brow, you can always add like 2 little units here and 2 little units here to bring that brow back down to normal. But you cannot correct a brow that's already been dropped. Another location for Botox is your nasalis muscles. When you squint, you pull your nose up, you can actually do Botox here, and that helps with those little bunny lines. We do a lot of locations in Dr. Hunt's practice. You can actually do Botox to correct a gummy smile. We do Botox in the mentalis muscle for kind of that golf ball pebble effect chin. You can also do the DAOs, the depressor anguli oris, when you have patients have them clench and show you their lower teeth. That's a great area to help lift that corner of the mouth. We also do masseter muscles. A lot of patients come in and they have a history of TMJ, or they do a lot of grinding of their teeth, or have that hypertrophic masseter, and a lot of times it actually will feminize the face by doing the masseter muscles. And platysmal bands, those vertical bands, those muscle bands are also great for Botox. We also do hyperhidrosis, excessive sweating of the armpits. And the key with Botox is stay with therapeutic dosing. Normal therapeutic dosing for the glabellar is 18 to 24 units for female. Frontalis, 12 to 24 units. Around the eyes, 18 to 24 units. Usually with the nasalis muscle, the bunny lines, we do 3 to 5 units per nasalis. DAO muscles, 3 to 5 units. Masseter muscles, do not undercorrect that. Do not underdose that area. Average is anywhere from 20 to 40 per masseter to get a therapeutic effect. Platysmal bands can do 12 per band. Sometimes you can do 40 on the neck, just depending on the person. But do look at the person, evaluate their muscle strength, have them do expressions for you prior to doing Botox. Botox is never cookie cutter medicine. Keep it therapeutic. You want that Botox to last 3 to 4 months. We know every time you do Botox, those muscles atrophy, they weaken, they don't really bounce back as strong, and it's behavior modification. Every time you do Botox, these muscles get weaker and weaker, and they kind of people are getting sometimes in time more longevity with their Botox, which is a great thing. For patients, you can also address these vertical lipstick bleed lines. This is a pursing, this is a sphincter muscle, your orbicularis oris muscle. Don't overdose with Botox on that upper lip or lower lip combination because you do need the functionality of the mouth. A lot of times I start with like 1 unit or 2 along that orbicularis oris muscle. Another nice place for Botox is under the tear trough, directly under the pupil. There's a depressor muscle there, kind of helps that double bubble, and maybe 2 little units right there can help open the orbit of the eye. dry. Again, do that on your younger patients. You don't want anybody that has a lot of lid lag or festoons or a lot of extra excessive skin. And you want to check their snap reflex to make sure they're a good candidate to actually do that injection.